It's August 30, Ukraine Media Center continues its operation. My name is Svetlana Cheparenko, and now we are about to have the interactive presentation of survey results, the satisfaction among Kyiv residents with mental health services. And let me introduce our speakers. Joining us are Lidia Martynova, founder and chair of the board of the public organization Psychability, Kostiantyn Zelenov, psychiatrist of the highest qualification at the Center for Emergency Medical Care and Disaster Medicine in Kyiv, member of the board of the public organization Psychability, Yevheniia Panichevska, director of the Research Society of Disabled People Institute for Social Policy, lecturer at the Department of Philosophy of the Igor Sikorsky Kyiv Polytechnic Institute, and Yevhen Bielonozhko, father of a person with a group 2 disability due to mental health disorder, member of the public organization Psychability. Good afternoon all. So, Ms. Lidia, before we proceed to the presentation, let me ask you, why is it important for us to hear about this topic and to hear out the results of this survey that you're about to present? The microphone, please. Good afternoon, everybody. So, why is it important? Because people with mental health disorders are a vulnerable category of population. Our organization was established in 2019 on the basis of community of a psychiatric hospital patients' relatives. Currently, there are 49 members. Among them are the relatives of the people with mental health disorders, the specialists in the area of psychiatry who have more than 20 years of experience of rehabilitation, and the people with mental health disorders on the stage of remission. Our organization is a creative collaboration. Psycho translates from Greek as soul, and ability translates from English as capability. So we've decided to take up this name, Psychability, like the capabilities of the soul. And our organization has set a task for ourselves to provide the barrier-free life for the people with mental health disorders. The activity of our civil organization contemplates support of the people with mental health disorders and the members of their families. This is why back in 2019 we've established the support group for the people with mental health disorders, and there are group trainings for them in rehabilitation programs. Also, we raise awareness, we provide different workshops, free lectures for the relatives of the people with mental health disorders, along with the club meetings. And we've set a task for ourselves to support the human rights and to support the social integration of the people with mental health disorders. To do this, back in October 2023, we became a member of a civil union called the Union of the Strong Ones. And we have this diagram on the screen. So a number of persons who applied for mental health support in the city of Kyiv, starting from 2019 until year 2023, there is a linear dependence. That's a tendency of growing number of reports, and the red curve demonstrates the relation, the perspective, the comparison of the number of reports compared to the year 2019. So it grew to 142%, and again the project that we've established, that we continue being involved in, is called the advocacy campaign to establish the service of an aid to a person with mental health disorders. Why do we advocate it? Because the result, in our opinion, may be a support extended by the Kyiv Municipal Council to achieve the barrier-free life for the people with mental health disorders. By establishing this service, the source for the support can be a municipal target program called CARE, and the goal of the project, in order to implement it, we've made this survey. The level of satisfaction of people with mental health disorders with medical and social services received in the community of the city of Kyiv. The task was to provide reasons for taking decision by the government of the city of Kyiv to make relevant decision. Thank you, Ms. Lidia. So, Mr. Kostiantyn, let's proceed to the survey itself. To what extent people with mental health disorders evaluate the quality of the services they are able to obtain in Kyiv? So, rushing a little bit ahead, they evaluate the level of services as low. But let's go step by step. First, let me explain it on a little bit more profound level. Let me explain the goal of the project. Why do we think that this service, such service as an individual aid, should be established? So the specifics of the mental health disorders is that people lose the skills, previously acquired skills of communication, and they need to have those skills. They require rehabilitation to have those skills redeveloped. So they have low initiative in life, social isolation. So basically they fall out of social life, and in practice it's manifested as people with such disorders cannot achieve, cannot reach out for such social services, even if they are numerous, which is not so. Such people feel it difficult. It's difficult for them to report to a doctor, to report to a rehabilitation facility. This is why we think that we need this individual aid. In the developed countries of like Europe, Canada, Australia, Japan, United States, there is such a person. They're called case managers. They existed for decades. It's been working for decades. Everything is known about this institution already, and as I delve into more details about our survey, for the people with mental health disorders, it still doesn't work in Ukraine. Well, again, let me repeat myself. We were trying to identify to what extent the people with the mental health disorders are satisfied with the services they received in the community of the Minister of Kyiv, and also we wanted to study the relation, the attitude of such people with mental health disorders to the Institute of the Aid. We were explaining the functions, the responsibilities, and there were 61 people diagnosed with mental health disorders lasting from 3 years on who were surveyed. From 3 to 45 years, we had people with a long-lasting track record of illness and with a number of hospitalizations ranging from 1 to 20. So what were the spheres of life covered by our survey. So first of all, it's the social communication. Yes, something that is clear to all of the people on our ad. The jobs, looking for medical services, and everyday self-sustainment. So again, there is no single person on the earth who wouldn't know about those spheres. So talking about the criteria, the subjective evaluation of a person experiencing mental health disorders, of their self-sufficiency skills, the satisfaction of those persons with their skills, criteria evaluation of activities of a person with mental health disorders in terms of search of the services in the community, their satisfaction with those services, and lastly D, the attitude to the potential AIDS support for the people with mental health disorders. For the time being, if there are any questions, we may answer them right away. So let's move to the conclusions. Okay, so these are the generalized data. This is the social communication. Yeah, let's go in brief, because we are more curious about the results. What were the conclusions that you've drawn? So yeah, let's keep the spheres. So this is the average in all of the spheres. I think that's what's important to cover. So 56% of the people subjectively evaluate the level of their skills in all 4 spheres as low or extremely low, so basically more than a half. 64% of the people with mental health disorders evaluate the level of satisfaction with their skills as low or extremely low. 69% of the people who were covered by the survey demonstrate low or extremely low activity in search for medical services. That's what I've mentioned. 70% of the people who took part in our survey have lower activity in search for the mental health support services, and what's even more important, 81% of those surveyed evaluate the quality of the services they've received as extremely low, and they have not received any services whatsoever. 36% have not received any such services whatsoever, and 81% evaluate such services as extremely low. And talking about the subjective opinion of the respondents about the positive influence of establishment of the Institute of the Aid to a person with the mental health disorders, so the average score was 2.2 with the highest score of 3, which means that those people think that such a service is necessary. They don't say we're not gonna make it without the AIDS, but the level of demand for such service is pretty high. If we have enough time, I would probably like if we have a volunteer. So probably let's just skip it and proceed more to the results, because we would like to better discuss the situation with the establishment of the Institute of an Aid. Okay, all right. So again, a couple more details. We've submitted requests to the relevant departments, the Department for Social Policy and Department of Healthcare. And the responses we got is that in the city there is one specialized ward servicing people with mental health disorders, which employs 58 employees, including 2 social workers. And what other services provided is the palliative care, representation of interests, support in course, and notification. There are no services on re-establishment of everyday sufficiency and self-sustainment. So within the program of care that Lidia Leonidovna has mentioned, there are such services contemplated: stationary care in the clinical psychiatric hospital, daily care for the people with mental health disorders and behavioral disorders, and social rehabilitation of people with intellectual and mental health disorders, provided by Ms. Nestorovia LLC. So, talking about the Department of Health, within the year 2023, as you were able to see, both communal facilities got 150,000 reports. Under the programs of medical guarantees of National Health Service, there are 5 multidisciplinary teams working in Kyiv, which are capable of providing such services of everyday self-sustainment. So 5 therapists and 5 social workers are employed on the team, which is 10 specialists. And from the Department of Social and Veterans Policy, we've seen that there are 2 social workers and 2 specialists in social rehabilitation, which makes it 14 altogether, 14 trade specialists who are capable of providing such services. So 14 specialists per 150,000 reports. Well, we've made a little calculation here, and what we've found out. It turns out that every specialist, or per every report, using the number of the specialists, there can be 9 minutes per year dedicated by each specialist to each report. Well, we may get back to the statistics of the year 2017. The figure there was 48 people in all of the clinics, which, after the calculations, made 31 minutes per person per year. So, long-awaited conclusions. The conclusion number 1 is, as you see, the services are catastrophically insufficient. Second, the services are of not relevant quality. So care is a good service. It's necessary for some people with mental health disorders, for some heavy mental health disorders that long last, but care is fulfillment of some everyday social functions for that person. Like, we help those people to live everyday life, and this care doesn't contemplate the renewal of those persons' skills or any training, because based on the work of our rehabilitation center that we've mentioned, we had such cases when people from socially misadapted were transformed into people who get back to work. They renew all of the skills, caring about themselves, social communication, job, and they know when to go to a doctor and how to do the prophylaxis and prevention measures. So this is what we need to focus on. And just let me add a couple of more words. We see that the people themselves who obtain those services, they evaluate them as either low or extremely low. It's not our theoretic observations. It's the people who get those services, and they say, like, those services are of low quality. So a little bit of some scaring information. If we don't do anything about the current state of affairs, what are we getting in the nearest future? So first of all, is deterioration of the quality of life of people with mental health disorders, because if they are not helped, the quality of life is deteriorating, just like for every person who is experiencing some illness, and in the same way the lives of their family members is deteriorating. And maybe if anybody present here in this studio has any experience, for example, they may have neighbors who experience some mental health disorders, and they can verify that the quality of life of the neighbors is deteriorating too, because it may result in different conflicts. Somebody's flooding somebody's not sleeping in the night and cry or like yelling in their sleep, or a person may be walking around the yard in the night hitting the cars, then the neighbors call for police. And another important factor is economic factor. The amount of expenditures for hospitalization of those people grows if there is no such help provided. As we suggest those people need to be supported financially because they have no jobs. And another problem is that it may potentially result in growth of expenditures for what used to be called psychoneurological clinic, for the people who have no families. As long as they have families, they take care about them, they provide clothing and meals for them. But when the parents die, usually no one wants to take care about those people with mental health disorders, that they cannot continue living in the society, and they end up in psychoneurological clinic. The quality of life deteriorates there, first, and second, it requires even more funding. So to finalize it, let me tell you why it can become better. The number of reports is growing as a result of conflict. It's like both civilians and militaries who suffer, and the number of mental health disorders is going to grow, the number of reports is going to grow. And if we don't implement this kind of service, there will be another catastrophe in this sphere of life too. This is why we suggest within the framework of this project to involve the Department of Social Policies, a number of civil organizations like us, those who have experience in this area, to make sure that this service is developed and well established. We may develop the branch standards, sector standards, and to start implementing this service the soonest possible. Thank you very much. Let's talk in more detail about this service. And now I would like to hear from Mr. Yevhen, to what extent what we've heard about the results of this year, how is it representative? For example, in your family you have a son with disability. To what extent are you dissatisfied with the existing services, and to what extent the need for such establishment of an institute of an aid to a person with disability, with mental health disorder, is present? Well, you see these two pictures. One is a child that the state of Ukraine and the parents invested in, and another photo is a photo of a person who is fighting a mental health disorder. And in this fight there are some achievements. If the first stage of life with mental health disorder is from one hospital to another, and I want to say that our hospitals work well, they fulfill their functions, at least in Kyiv, like 1 month, sometimes more, and people, they renew from their psychosis, and then they get bored, they get back home, and what's going on at home? A couple of conflicts with the neighbors, a couple of imaginary enemies, and people get back to their mental health disorder immediately. And in the families, the process of adaptation of that person is going on. They try to live with those psychoses. They report to the hospitals by themselves. So this second stage is where people live more or less self-sufficient life, not only in the hospitals but at home too. And as they say, as long as the families have hope, they have faith, they have resources, the people may continue living at home for a long time. The compensation of those social skills is all fulfilled by their families with money, with involvement of specialists, and then there will be third stage, and my son is coming to this third stage. Like, not all of the family members are with him. We don't have any more resources, that money, and we're facing a choice. Me as a father and him as a person with mental health disorder, whether we should send him to a mental health care facility where he's staying now. Why is he staying there? Before we cannot ensure proper conditions for him so that he at least gets normal meals. We don't have such an opportunity. So he's been staying in the facility for 1 year, but he's 36 years old. He has intellectual, he has a remission, and he has a desire to live his own free life. And now we're having this question to our society: what will be a social infrastructure in place to support such not fully capable persons? I mean, in a sense that those people cannot fulfill a number of those social functions that we are used to, so they will never be able to fulfill them because they have to have their skills, their personality renewed all the time, their capability to do something on themselves need to be renewed again and again. So again, let me proceed to the last part of what I was going to say in this particular case. So first of all, everything that Mr. Kostiantyn has said is like 100% match with the life of my son. So for me, the question is like, if I take my son from the mental health care facility, which social situation is he going to end up in? Who is going to continue supporting and helping him? Again, let me emphasize it, not so much a care, because the care is necessary when people are in vegetables condition, but we need just them to be supported. So first of all, how is he going to be able to report to the hospital, not only psychiatric hospital, but just a regular hospital? Like, have you ever managed to reach a specialist through Health.me system, for example? So, but for them, it's a difficult way. But if there is a person by their side, like me, I can say that I'm a 100% social aid. I'm a therapist and psychiatrist and police and a neighbor all together. And I add my activities to his activities, and he learns, and those skills are renewed. He renews his skills to live his life on his own, to withdraw from the conflicts, get away from the depressions and suicides. This is what I do. If there is yet another person who helps them to do so, somebody they can report, and not to me, because again, it's important with those people with mental health disorders. If there is a person working with him representing a social system, it's way better than a family member, because the family members sometimes they are enemies. If it's a paranoid disorder, for example, the relatives are on a very close distance. It's important to have a state between a person with a mental health disorder and their families in their specific life situation. So there are three sectors where we need skilled, properly trained person capable of helping in a way that those people with mental health disorder can live their own life. It will improve their self-evaluation, and they will need to report less and less to the hospital. So again, it's the sector of the medical services in the broad sense. What I'm saying is that such people cannot reach medical services on their own. For example, they need dentist services, and to do that, they need somebody to plan their meetings with the dentist. Another important sector, like obviously my son is disabled. He cannot work 8 hours per day, but sometimes he is capable of working. I mean, he was able to graduate. He got a bachelor degree before he got that mental health disorder. So again, there is a person who needed, who could get him in touch with employers, and we have such people. They are not so numerous, but they exist. But again, it shouldn't be a sister or a father. There should be a person representing social system. That's incredibly important. And third sector is like everyday life, everyday communication. And here they need support too in case of instead of calling to police or psychiatric brigade or get involved, we need a person who is capable of mediation, social mediation. We have wonderful mediation courses, wonderful mediation specialists. If those people are properly trained, they will make order in those situations with the neighbors, and in case of necessity, they are going to call to police or to timely put the people with mental health disorders in hospitals. So the choice is simple. If we have individual AIDS in 1 year, I may take that risk and get my son out of the mental health care facility, but he's getting care there. I have nothing bad to say. They're doing their job, but my son doesn't want to stay there forever. So that's the dilemma. And the situation is more or less like this with the people who got psychologically affected by the war. I mean, the military, their family members. But again, a function of an aid to a person with a mental health disorder is very specific. It's not one and the same. We need a dedicated program supported by the government. No civil organizations can do that. This is why I'm addressing you to support this advocacy. Let it happen in a year or 2 or even 50, but let such institutional function be established in our social system, because it will provide such people with a way to live. Thank you, Mr. Yevhen. Hopefully it's going to happen sooner than in 50 years. Miss Yevheniia, can we talk a little bit more about this function of an aid? Can you please tell us what should be the education, the skills, the training such persons have, and how many people with mental health disorder can be covered by one such aid? Well, if we talk about education here, one way or another, we're getting back to the last paragraph, like cited by Mr. Yevhen, about the participation of municipality, community, the state, their participation, not like represented by some light boxes like support your mental health, but the direct participation with the partners. So today we're meeting an organization who have expertise of a unique nature, because that's an organization that is personally motivated. The members of that organization are personally motivated. Those are the people who will make it until the end, even if it lasts for 50 years. Hopefully we're gonna see that happening sooner, because we all want our children to be supported no matter what. That's why it's important for us not to lose the momentum, to continue being perseverant in search of communication with the municipality of the city of Kyiv. This communication is pretty complicated because the majority of the departments, like medical department was mentioned today, and the department for social politics, so their activities is made at finding generalized solutions, and now we're talking about a very individualized situation. And in my life, not only me, we have a community of parents of children with disabilities. I'm having an 18-year boy with autism, and from the very beginning we were trying to build the individualized routes. And I'm looking at what Psychability is doing, and I'm imagining barriers on their way. I imagine their way. I realize that there are a lot of parallel processes. There are some consequent processes, like Mr. Kostiantyn has mentioned, the establishment of professional standards. So lobbying for this service and establishing of standards are parallel processes. One will not work without the other, but again, we need the municipality to get involved with the money, first of all, because as we talk about the municipal programs, we mean that the specialists are being supported with the money. That's the basic thing that we need, because both Mr. Kostiantyn and Ms. Lidia were mentioning that they either are in touch or they are preparing, or they know how to prepare, how to train those specialists. But on top of that, there are professions that are being taught in the higher educational institutions, like social work, for example. It exists in the higher educational institution where I work. We add more disciplines to the training course, knowing that demand and knowing that the city of Kyiv can then take part in employment of those specialists. We can more actively move this topic. I know that other higher educational institutions support it, so we can move more actively with the training of case managers. That's a broad notion, but case managers in that specific sphere for that need. That's why, what are the skills and knowledge required here? First of all, I come across frequently, I would like to advise the representatives of our social support department to undergo a training course of social work in higher educational institutions, so they're aware of how it's done. And it's not only for government officials or municipal officials, but all of us, we should be well aware of the legislation, because in the legislation there are opportunities or potential for cooperation between government and non-government sector in this area, and it's all about the resources, and such resources, the Psychability organization, because we have many organizations working with the kids, and very small number of specialists who work with the adults. It's more difficult, it's not so bright, the pictures are not so nice, and it's a very difficult routine. So if we train such specialists for our specialties on top of those disciplines that we have one way or another, which means the work with different categories of population, probably we would be able to add more work on organization and implementation of state standards, because again there are parallel processes to get funding from the care program. That's a generalized dream. That money should be aimed at something. For example, now the city of Kyiv, through the state standards, implements, like Mr. Kostiantyn has mentioned, the extension of support through social standards. Talking about this such social standard to support a person with mental health disorder, such standard does not exist. But, for example, I have an experience from the stage of dream to implementation of state standard of support during the inclusive training. That's something similar, but it's similar in its way, and I know how much was vested in here, but we're talking about the kids here, like the amendment with the different chapters of the law. We were working with the Ministry of Social Policies establishing the standard, but what I'm seeing now, that there are obstacles in its implementation, even now when there is funding. And what is an obstacle is the training and education of specialists, acceptance by the community of this problem as something present, something that affects lives of everybody. And there are some results in the future, such as relief of financial pressure on, and here comes the list. Like for those who have experience of some psychiatric conferences, they mentioned there such a Delikov rate. It's a rate that is calculated, and it demonstrates the burden that a family bears in case they have relatives with mental health disorders. As we say, the families are the cells of society, and this is that cell falling out of the society because they invest everything in support of one single family member. And there is a number of things that is taken into account by Psychability organization. They raise awareness, they provide expert support, they support the people directly. And my address is more about how important it is to pay attention to such organizations, and to what extent, in my opinion, the municipal government is supposed to have close ties with such organizations, because the community is growing. We see that the mental health disorders of specific people, of adults, are growing as the circle of participants. We keep hearing a lot about those problems faced by the veterans, the family members of the veterans. So if we teach the students, it will be about the support of people, work with legislation. And now my organization is the provider of social services. It's extremely difficult. So again, all that work is supposed to be made as education, structured as education program. We work with the students, and the experience shows that it takes time for them to come to this work. Like now they are young, the world is open to them, and after they turn 30, they will get back to this profession. So again, my experience of civil war is about those organizations that have qualification. They achieve success earlier than in 50 years. Thank you very much. Do we have any questions to our guests? Well, in case we don't have any questions on the floor, let me ask the floor. Ms. Lidia, Mr. Kostiantyn, what are the further steps to make sure that this mechanism starts working, that it starts working as soon as possible? What is your vision of the roadmap? Where do you want to start? Whom to unite with to make sure that this institute of 8 is established. So the further steps are as follows. Step number 0, finalize this project that we're promoting now. In the beginning of October, we've decided to dedicate it to the Day of the Mental Health, so we're about to establish a roundtable where we will invite the representatives of the municipal administration, the representatives of the departments that I've mentioned, friendly organizations, higher education institutions, representatives of higher education institutions, obviously media, and, well, today we put it like in brief, and during that roundtable we will be able to discuss it all, and by the end of the year we hope that it will end with Kyiv Municipal Administration saying, yes, we recognize that this service is necessary, we are ready to extend funding to solve those problems that I've mentioned, development of the sector standards and their implementation in real life. So if we have this consent by the end of this year, that's a perfect outcome. We will make it definitely sooner than in 50 years. And what else should be done? Like Yevheniia said, we have to unite around the solution to this problem. We all have to understand that mental health is not about the light boxes and placards and slogans. It's about all of us. Every single one of us has some mental health disorders in this or that extent. And if we take care about this issue now, in a couple of years, we will be able to, so to say, to lay some hay at the spot we fall at. So we will have the generation of experts educated who understand that they are not only supposed to get grant funding, somehow to distribute them, and then after us the deluge. But they will understand that they work for a 1, 2, 3, 5, 10 years perspective, that I need it as an expert, my families, my children, my parents need it, because in a couple of years it's gonna get even more difficult. And let me add a couple of words in order to reinforce solutions so that more people understand what is it like to be people with mental health disorders. Before the beginning of the big war, we've made a film, quite an interesting one. It's called Out of the Vicious Circle. We suggest you view that film, and in that film you're about to find an answers to those questions asked by the son of Vladimir. What should a person do who doesn't want to end up in a psychiatric ward? And what should the people who end up there do? In the documentary, there are the real people filmed, the people with mental health disorders themselves, their parents. Is quite interesting. It's short, 15 minutes only, but you are going to be able to understand how important it is. It was important before the beginning of the big war, and now those problems only jeopardize. And we really hope that the Kyiv municipal government will hear us. They understand that one of the key figures of the well-branched psychosocial rehabilitation system is the aid to a person with mental health disorder. Why are we putting it like this? Because unfortunately we have some negative experience back in the 90s. There was Center for Medical and Social Rehabilitation established at grant funds, but it's only been existing until the year 2019 because they ran out of funding and the government has not extended any funding for renewal for rehabilitation until this day. Unfortunately, that's why the support of the government is extremely important, and we hope that we are gonna be heard. Thank you very much. I wish you success in your project. I hope it will be implemented as soon as possible because, as you properly put it, as the graphs demonstrate, unfortunately the reports grow from the people who start experiencing some psychiatric trauma. So let me remind you, we just had an interactive presentation of the survey, the satisfaction among Kyiv residents with mental health services, and Ukraine Media Center will continue next week. Stay tuned. Glory to Ukraine.